Hi, everybody. Welcome back. It's Michael Quirke here, and I want to talk with you today. I want to follow up on my live stream from last week, in which we talked about CPTSD versus BPD. And I want to say a little bit more because I appreciate the comments. I received some very kind emails about the video, and I'm really glad that you found it to be helpful. So here's a little bit more of my thoughts about CPTSD versus BPD. The letters in the acronyms that I'm using stand for complex post-traumatic stress disorder, and we're comparing it to borderline personality disorder. These two psychological conditions overlap in a bunch of different ways, but there's also some key differences that are important for you to know about. These differences matter if you are hoping to get a good outcome from your therapy. Over the last few years, there's been a growing recognition of how much psychological suffering is forged in the fires of trauma, especially early life trauma, or what we refer to as developmental trauma. And it's very true, traumatic experience plays an important role in our psychological suffering, but it is not the only cause. It's a mistake to think that. We're fortunate that these days the internet gives us a quick and easy access and the ability to educate ourselves. In our age, we have a large amount of information. Some of it's good, some of it's bad, and it sits just a few keystrokes away. Now, I'm a huge proponent of educating ourselves because that's how we can ask better questions of our healthcare providers. And I'm also a licensed therapist. And one of the things that strikes me is that there is a great number of people who self-diagnose. There seems to be no shortage of men and women who claim all sorts of diagnostic labels after doing only the most brief, cursory internet search. Now, probably every single day, I hear how these men and women self-diagnose by watching TikTok, by getting opinions and recommendations from strangers on Reddit, or by spending a couple of minutes on YouTube. Many of these people end up claiming labels that don't really explain their symptoms very well, and they don't provide them with a reliable roadmap which leads them to recovery. The reality is, it takes years of training and experience to be able to hone your diagnostic skills. Accurately diagnosing somebody it's actually a very important task. And given that there's a human tendency for all of us to have plenty of blind spots and to make mistakes, self-diagnosis is pretty unlikely to be accurate. And this brings me to the topic of today's conversation. Once again, it's about CPTSD versus BPD. As the topic of trauma and trauma recovery has grown much more popular online, I've seen quite a bit of confusion. I've seen a lot of understanding, and I've seen a lot of misinformation grow. So, what are some signs that you might be suffering from BPD? These signs are drawn from my observations over a quarter of a century in all sorts of clinical settings, from private practice to higher levels of mental health care settings like partial hospitalization programs and intensive outpatient programs that I've worked in. And I want to take a moment, just having said all that about a little bit of my background and my experience, I want to be clear with you that I am a therapist. I'm a licensed therapist in full-time private practice, but I am not your therapist. I do these videos to help you learn to help you educate yourself, and to help you, most importantly, ask good questions of your healthcare providers. That is what's going to help you to live a life that you love living, is when you get good care. So when I think back over the men and women that I've worked with, what are some of the most obvious signs, or the most important signs of BPD? I would have to say that the first one is blaming. If you are a person that is in the BPD range of symptoms, then you're probably going to have a penchant for pointing the finger at other people. You will probably tend to see other people and situations as being responsible for upsetting you. And you will also tend to think that it's other people and circumstances and conditions that have all the power and all the ability to set things right. What I mean by that is you might not see it as your difficulty dealing with your own emotional reactivity. And that brings me to another important characteristic. Many people with BPD, and again, these are some of the hallmarks that I'm talking about, they tend to have a sense of low personal self-responsibility. They don't tend to hold themselves accountable. Many men and women with BPD, they do tend to be quite viciously critical of themselves, but that's not the same thing as accountability. They're very different things. Another trait that I see frequently in people with BPD, or many BPD traits, is a chronic sense of helplessness. The helplessness can be kind of a default setting, and they will tend to see themselves as victims in relationships, victims of other people, and they really do not like it when other people treat them as if they're competent and capable. Often that will provoke a strong emotional response that's kind of like an overwhelm or a meltdown. One of the things that goes along with BPD quite frequently is that the person with BPD will tend to have low insight, meaning they just won't have a great grasp on cause and effect, and they just don't tend to connect the dots very easily. So, what that means is often clients with BPD will view each and every upsetting or troubling situation as unique unto itself. Now, I call this the problem of the week or the crisis of the week. So they don't see the pattern um, in their difficulty with emotional coping. They don't string things together in a way that reflects on them. An important trait of BPD is also what we call splitting. And that's a kind of black and white polarized thinking that lacks nuance. And it is an emotional reactive, it's the emotional reactivity that fuels the thoughts and the beliefs and the values of the person with BPD. So, when you're talking with a person with BPD, most of their stories are going to contain somebody who is a demon, a perpetrator, and an angel, an innocent victim. So, it's very extreme black and white thinking. Someone is very toxic, and someone else is completely innocent. Now, another important theme in or another way that people with BPD tend to see themselves is as as I mentioned, helpless victims who are at the effect of evil perpetrators. People with BPD tend to have very extreme opinions. They tend to have difficulty with accepting other people, and other points of view tend to be very frightening or enraging to them. And they have a very difficult time understanding or tolerating other perspectives. Another key sign is a chronic high level of interpersonal conflict. BPD relationships, they tend to have quite a bit of friction, a lot of stress, and a lot of conflict. And that's because often people with BPD can be quite antagonistic. They can impulsively lash out in anger when they're unhappy, when they've got frequently low frustration tolerance. And so they will tend to escalate and attack. Again, blaming, we're talking about punishing people who don't do what they want, or punishing people who make them feel bad. And this can involve smearing people, doing what they can to destroy a person's reputation, or and a lot of this acting out nowadays is occurring online. So BPD anger tends to be very vindictive and very hateful. Many of the men and women that I've seen in my work have had relationships in which they both perpetrate and are in the receiving end of emotional and physical abuse. They tend to be involved in very high conflict relationships. When it comes to BPD, another kind of signature symptom is a chronic fear of abandonment. Much of the personal and interpersonal instability in the life of a person with BPD stems from a very deep fear of being left behind, of being abandoned. And if you have BPD, abandonment is probably one of your biggest concerns in life. Now, to some extent, that's human, but it is not an overriding focus or obsession for people without BPD. Another thing to look for is impulsivity, the difficulty controlling behavior, difficulty following through with both medium and long-term goals. And the reason for that is because of the emotional reactivity that I talked about earlier. So let's talk about CPTSD versus BPD and say a little bit more about what causes each of them. CPTSD is the result of trauma that is severe and chronic. As I mentioned, often it's early trauma. It's trauma that is repetitive and prolonged. And some examples of this are physical abuse, sexual abuse, human trafficking, growing up in a home where there is violence, and that kind of thing. BPD, however, is thought to be the result of a combination of both genetic influence and what we call adverse parent-child relationships. Quick side note, if you want to learn more about that, visit my blog. I've got an article on what we call adverse child experiences, or ACEs. It's a very common concept in the trauma treatment world and in the trauma recovery literature. So, but back to what I was saying, it's important not to oversimplify what I'm talking about. Many, but not all, but by no means all adults with BPD experienced abuse and neglect as children. But it is a very common myth that all borderlines were abused and neglected as children. The research just doesn't show that, nor does my personal clinical experience. CPTSD versus BPD. So, what are some of the symptoms that they share? What do they have in common? Both disorders actually have a lot in common, and that's the reason why they're often confused. In my work, I've seen both CPTSD patients and BPD patients struggle with relationship impairments, um, a lot of chronic upheaval in their relationships. I've seen uh, both uh, people with these disorders struggle with dissociation, and for the clients with BPD, that's often when they're going through a period of severe stress. It's very common. Anxiety and panic are very common for both of them. Depression and low moods are very common for both of them. And unfortunately, so is suicidality, self-harm thoughts, suicidal thoughts, suicidal gestures and attempts. Emotional reactivity are common with both, and so are hypervigilance, the sense that you're always waiting for a problem, always waiting for danger or trouble to strike. But it's important to talk about the overall tone of what I call their relational style. It's pretty different. So let's talk about CPTSD versus BPD and the different relational styles that they have. One key difference that I've observed is in what you call the overall relational style, the mode that that person operates in when they are in particularly a close relationship. BPD clients typically have very low tolerance for aloneness. It's not something that they do well with. They tend to need another person in order to self-regulate because they usually can't feel okay without someone else helping them. BPD relationships are usually very intense, and partners of BPD clients that I've worked with have told me that they feel like they are constantly in a crisis, constantly putting out fires. They might feel like they're on a roller coaster every day. And interestingly, a phrase that many of them have used is they feel like there's just this never ending push pull cycle in their relationships. Many of the loved ones of persons with borderline personality disorder, that could be partners, that could be family members, dear friends, they use a common phrase to describe their experience of what it's like for them to be close to somebody with BPD. And they will often use the phrase from the title of that very famous book. They feel like they're always walking on eggshells because they're constantly treading lightly because they want to avoid setting off a storm of emotional reactivity. But when it comes to relationships, the CPTSD style is actually pretty different from the BPD relational style. People with complex PTSD, they don't usually have that kind of an effect on the people that they're close to. And that's because here, the basic fear isn't really one of abandonment. It's a fear of basic physical and emotional safety. So think about it. If you were chronically abused, you would likely want to avoid putting yourself in danger. You would want to keep your distance. If you got too close to somebody, you would likely have to work to keep yourself out of a fight, flight, freeze, or fawn response. And your nervous system might be quite adept at helping you disconnect, numb out, or dissociate. So while persons with either disorder can feel as if they're always living life on red alert, they're always ready for danger. The hypervigilance that I talked about, it does have a different focus for each of them. The person with BPD is usually going to be incessantly scanning for any signs of potential rejection and abandonment. The Cptsd client is usually, as I mentioned, hypervigilant just about basic safety issues. CpTSD and BPD treatment can look quite different. Struggles with avoidance loom quite large in the lives of somebody who has CPTSD. I have seen this over and over and over again. Many of my CPTSD clients have shared with me that they avoided treatment for years, sometimes 5, 10 years before they went to their first appointment, elapsed between the time where they actually knew they needed and wanted help to get better. Despite the suffering that these people went through, they avoided therapy. And that's because the idea made them uncomfortable and they tried their best to handle things on their own. Many have confided in me that just the idea of working with a therapist filled them with fear and shame. Sadly, many have also shared with me how when they finally made the decision to get therapy, they got no traction in their initial attempts at psychotherapy. And as I've mentioned in some of my other videos, often this is because they were not working with a trauma specialist, and despite everyone's good intentions, they did not have proper treatment or a proper diagnosis. But the clients who fit more of a BPD diagnostic profile, they've often had multiple failed attempts at therapy. Many of the psychotherapeutic relationships that they've talked about with me did not go well. They were therapeutic relationships that you could describe as being filled with conflict, having a definite lack of cooperation, and a roller coaster of crisis management and emotional reactivity. BPD patients have told me many, many, many stories about how many times they've dropped out of treatment prematurely, how they've become attacking, disdainful, rageful towards their therapists and towards the other healthcare providers in their lives, how they threatened to self-injure, or how they did self-injure in an attempt to get what they wanted, to manipulate the therapist, to manipulate their loved ones, or to manipulate their doctor. Many clients who've been diagnosed with BPD have often used therapy impulsively. They've used it chaotically. So, for example, only when it's an absolute crisis, they needed to show somebody that they were doing whatever was necessary to save a relationship. Sometimes they've needed to get out of a legal problem, so they will go to a couple of appointments of therapy just to, try to let someone else know, or to convince someone else know that this time they're taking it seriously, so they should not face the consequences of their behavior. Other things that got in the way for clients with BPD that they've shared with me is that they spent months or sometimes years just venting and blaming, again, going from what I call the problem of the week or the crisis of the week, just getting their feelings out, but not taking action or not developing the skills to regulate their emotional self. Now, many people with BPD have shared with me how they fled from treatment the moment they were asked to take responsibility for themselves and their behavior. Dialectical behavior therapy is a well-established treatment for BPD. um, in it, they talk about something very interesting. They talk about what's referred to as therapy interfering beliefs and behaviors. And if you've ever worked with a DBT therapist, that is going to be the focus of the treatment right out of the gate. Those are the primary goals. And that's because DBT practitioners know that if you don't really get a handle on those, the therapy is going to blow up. In short, DBT and therapy interfering beliefs and behaviors were originally conceived as a cluster of symptoms that prevented the person with BPD from being able to benefit at all from traditional therapy, like psychodynamic work, for example. And the thinking at that time was that if you could teach BPD clients to gain mastery over their impulsive behavior and over their intense emotional reactivity, then they would actually have the potential to benefit from other forms of psychotherapy over the long term. So, CPTSD versus BPD. Why does this matter? It's because an accurate diagnosis guides treatment. If you can't describe and outline the problem that you're dealing with, it's not so likely that you're going to solve it. A good diagnosis guides good treatment because it ties your struggles to relevant therapeutic goals, goals that make sense for you. Now, sometimes clients seek trauma treatment, but they also have significant traits and symptoms of BPD. They might even meet criteria for both disorders. If you review the symptoms and signs of BPD listed, that I've listed out at the beginning of this video, it's probably pretty easy for you to imagine how they could interfere with the effective treatment of trauma and the resolution of trauma. Trauma symptoms don't typically resolve until you can establish a safe, caring, cooperative relationship with your therapist. And for many people with BPD, that's actually where the work is. Getting a good cooperative connection is essentially the task of therapy for many people with BPD. So, all right, so let's wrap up here. If you think that you're suffering with some of the symptoms that I've talked about, some of the symptoms of CPTSD or BPD, and you want to learn more, please visit my website. I've got an extensive trauma treatment library there, and you're welcome to look around. I hope you find it helpful. I also hope that you find my other videos on my YouTube channel to be helpful. Finally, like, subscribe, comment, and share if you know somebody that's interested. Also, share with me your experience if you have been dealing with BPD symptoms, if you've been dealing with CPTSD. I'd love to hear. You can probably help a lot of other people by sharing what you've been through and what helped you, what didn't, what to look out for. Thanks so much. I hope you have a great day and come back soon.